Welcome to TED Talk time on Tranq Source. This is number 4. That was Milo snorting. Everyone's taking their afternoon naps. So, I'm hoping we're going to get through this. Number 4, if you missed the other 3, definitely scroll around. I will be putting everyone in playlists, but for right now, I will do a quick overview of Tranq, the street name for xylazine. Hoping that Milo doesn't throw up his antibiotic. He's kind of acting like it. Tranq is an animal sedative anesthetic that was developed in a lab and manufactured in Puerto Rico in the 50s. Initially, it was going to be for human use, but they found that there were too many cardiac factors. It caused bradycardia, or lowered heart rate, to the point that blood pressures would plummet, and there was no way to reverse the symptoms, as is quite common in the pharmaceutical world. They started sampling it on animals, and they found that animals didn't have this problem. They weren't quite sure why that was, but they could use it for veterinary medicine. So it went off the human table and onto the animal table, so to say. If you are new to this channel, my very first college degree is in animal health care, animal husbandry. I was a licensed AHT in California for many years, both in LA County and Shasta County. I worked on large animals and small. I have used xylazine with animal sedation, mostly in horses, but occasionally in dogs. There is a reversal in yohimbe, but the problem with humans is that humans have to be monitored very closely if yohimbe is introduced. Again, cardiac issues. Anybody in the medical field can tell you, probably one of the scariest things to deal with is labile hypertension, hypotension. I honestly can't say in all my decades of human health care, there is nothing more scary than not being able to control a patient's blood pressure with medications, because we kind of get complacent. We put so much faith and trust into medications to stabilize blood pressures that when they don't work, it's kind of like a split second thing, but you're in shock. It's like, what? But I digress. So there's our Tranq, being, of course it's called xylazine, but we know it as Tranq. It's being produced by a manufacturing plant in Puerto Rico. Everything's going hunky-dory until addicts in Puerto Rico start sprinkling a little bit into their heroin, followed by sprinkling it into their fentanyl. Because as we have seen in previous TED Talks, the street composition of heroin is pretty non-existent. Heroin's really not out there anymore. It's all fetty. And now on the East Coast, it is a lot Tranq sprinkled into that fetty. Things always travel east to west. So you'll find it in larger cities on the West Coast: Seattle, Portland, San Francisco, LA. You don't see it so much in small towns. Taking Pennsylvania, which is ground zero for xylazine, small towns have it. So why Pennsylvania? Well, There was a program in the 90s where addicts in Puerto Rico were brought to rehabs in Pennsylvania, Pittsburgh, and Philly predominantly. So if your loved one gets shipped off to a rehab in Pennsylvania and you live way down there in a tropical island, you're an American citizen. So what are you going to do? You're going to transplant your family. And then they get out of rehab and not everybody stays clean. They missed their Tranq. And so the Tranq business began. This is why Penn State is one of the leaders in Tranq and Fetty addiction. Their addiction medicine college is probably one of the finest in the world because they have a test tube in their city. It's called their city. From Philadelphia, the Tranq started moving outwards in a ripple effect, and then large cities started finding people on the street. EMS couldn't resuscitate with just Narcan. Now, if you're unfamiliar with the Narcan protocol, generally heroin takes about 1 or 2 hits up the nose of Narcan to resuscitate a patient. If they have fentanyl on board, depending on the amount of fentanyl on board, it can take anywhere from 4 to 8. That's a lot of Narcan. The problem started in the early 2000s where people in EMS were having patients down and they weren't coming back with the Narcan and they couldn't figure it out. Fast forward to 2020, and this is happening frequently. Those patients go to ICU on supportive care, ventilators, the whole bit in ICU. And the ICUs are filling up with these patients. And then they determined, oh crap. Sample bags from the street were showing that Tranq was starting to become such a large portion of everybody's hits that it was becoming a citywide and then a nationwide problem. In the mid-2000s, they started seeing the sores. At first, they weren't sure where it was coming from because most of these people were homeless. And with poor hygiene, they don't have the ability to take frequent showers at that time. They were, many of them with mental illness that prevented them from seeking good hygiene techniques. So they weren't quite sure what is causing these open sores. Culturing these sores, they determined that it wasn't a new bug at all. It was something from the inside out. And that's where they started to discover there's 2 factors to why Tranq causes sores. Scientists aren't actually sure which is the leading cause, if they both are, if there's even a third unknown mechanism going on. But so far at this point, as of February 2026, they've determined 1, Tranq has a higher acidity than fentanyl, heroin, any of them. It doesn't bother animals because animals' pH is different than human. Secondly, it has a larger molecular build and it also is a vasoconstrictor. So all these distal or far down from the core vessels shrink. And then those larger molecules get trapped inside. So you have your capillary, it shrinks a bit. Regular red blood cells can travel through by squishing themselves, but the Tranq molecules could not, and they would get stuck. And then what ended up happening was with this higher acidity, they started burning their way up. So this is from a journal exploring the etiology of xylazine-related soft tissue injuries, where it states higher acidity of certain heroin source forms contributes to vein damage. So the results observed were extraordinarily severe. Several themes emerged relating to wound etiology. Instead of doing this, I'm going to read it to you. Tranq dope injection caused burning sensations. 2. Vein loss occurred rapidly following uptake of Tranq dope. 3. Vein loss resulted in increased injection attempts, the use of large central veins, such as the jugular and femoral veins, as well as more frequent skin popping techniques. And number 4, wounds called Tranq burn rapidly followed vein loss. The average pH of the samples was 4, containing fentanyl, ranging from pH 2.1 to 5.9. Samples containing xylazine ranging pH 3.6 to 5.9. I'm going to show you safe pictures. So this is how it starts. Looks like nothing. Now we've been through this before when we've done previous TED Talks on Tranq source and showed Trish as a sample. Kind of a nothing burger, just a little dot. We've seen them on Trish, and we've actually watched them progress. After that little bump caves in and opens up, this starts to happen. If you are squeamish, don't look. I will tell you when it is safe. If you do not get it treated, this will happen. And people walk around every day with this. On a side note, if you go past, here's the pictures. If you keep scrolling down, there are similar articles and different sightings that you can click on. If it says free article, you can click and read them. I am going to warn you, some of the pictures are absolutely jaw-dropping. Okay. But some of the subjects, like implications of xylazine exposure in pregnancy. Yeah. Skin ulcers in a fentanyl injecting individual in South Florida, United States. That's a case study. It was actually quite interesting. This was kind of scary. I knew they weren't real pills from the doctor, characterizing consumer knowledge and experiences of identifying counterfeit pain pills in a fentanyl-saturated drug market. Xylazine and fentanyl co-administration delays wound healing in mice. This one is brand new, January 2026, and it was fantastic. The Donovan Memorial Lecture, Fentanyl Plus, a new era of fentanyl polydrug combinations in the North American overdose crisis. Fantastic article about all the different fatty analogs they're putting in, designer drugs they're putting in that make xylazine look like a Tylenol. So this is a really good street protocol sheet, what you need to do to treat people that are going to stay on the street, because a lot of people do not go to the hospital. If they go in the hospital, they AMA as soon as they start to feel withdrawals coming on. Withdrawals from heroin, bad. Withdrawals from fentanyl, awful. Withdrawals from fentanyl and xylazine apparently are horrific. There are some pictures you don't want to look at. So, as we have seen before on Trish, these little dots turn into craters. Those craters necrotize. They open up because they're literally being burned from the inside out. We've seen them, haven't we? Oops, sorry. We've seen those on Trish. So I don't gross everyone out. I've covered up the pictures. They get bad, okay? But this is for street teams, and this is how you treat these wounds for people who are not going to the hospital. And every patient has that right. Eventually, limbs, the wounds expose bones. There are photos I could show you of exposed arm bones, both of them in a forearm, and the person still had use of these 3 fingers. The bone was literally broken and hanging out, and they still can move these 3 fingers, which means they could still shoot drugs, and they weren't going to go to the hospital. They were walking around with exposed bone, probably 6 inches of it. Did they feel pain? Of course they did. But as soon as they took a shot, they didn't feel pain anymore. The problem is these wounds, if not bandaged correctly and bandaged often, kept clean, kept moist, they will get infected. As I said, Penn State is probably one of the best sources for addiction medicine, inpatient, outpatient, street teams, you name it. They put out a fantastic, it's a whole thing on xylazine wounds for practitioners, but I think everybody should actually read it. You just have to put up with some pretty gross pictures. But it is PennCamp.org, and you can put in the search anything you want, but it goes into all kinds of stuff, wound care instructions. They even have videos from YouTube, okay? This was probably one of the best, and it is from the street team and their public health department. Wonderful videos. If I go lower, you're going to see some pictures that'll make you lose your lunch. And before I get into Kim, I want to tell you, I did look through many journal entries, and I only chose those that were 5 years or to now, because addiction medicine and caring for patients with Tranq sores is a fluid situation. It is constantly changing. Now, I have some trepidation about her meds that she's getting right now. She is technically not clean, okay? I think we all know that. But I do want you to know, I did go through, this is caring for patients with opioid use disorder in the hospital. This was another one, initiating medications during hospitalization and strategies for ensuring linkage at discharge for patients with opioid use disorder. This one was extremely long, but it does go into bridging and meds to help bridge the patient. Just so you know, every single hospital, no matter how good they are, how misguided, not every hospital in the United States understands how to deal with this. Shit, not every hospital in the world, because xylazine is a new phenomenon. They can't even agree on treatment plans, but nobody wants a patient to suffer, even though we're in this anti-opiate crisis, which is ridiculous, unless apparently you live in Florida where they hand them out like candy. Everything says about bridging to transitional care, peer support, bridge and transition clinics, community, patient outreach. Everything is, there is an effort made so that the patient is not suffering and gets appropriate care and gets appropriate support while in hospital or in transitional care. If you'd like to read that very long one, it is from sciencedirect.com. You can put in the search engine the title that I read off, and it should pop up. So if you just go in and put Tranq wound x-rays and hit images, you don't get to see a lot, okay? Not a lot that isn't blurred. Now, we can unblur them, but I'm not going to because I like you all. Not everyone can handle it. This is the famous photo I was referring to. As you can see, the thumb is avulsed. He's lost his thumb, the end of his thumb. There is no skin on it. Last knuckle up. And this is the 6-inch wound where the bone was broken and exposed. Actually, both bones were exposed. The x-ray is showing underlying tissue. So these were both exposed. This is just the underside of his arm that you're seeing on the flat plate. So as you can see, the bone is being eaten away. You can see from the marrow canal and the pitting. Actually, addicts will shoot into their bone. They will shoot into the sores and create them to be larger and larger, because essentially you're putting like Drano in a wound. And what's going to happen? It's going to keep eating away. Now, while we're discussing how usually it's arms and legs, that's where we always see, Tranq sores. You're seeing chests because, it can get in your rib. It can get in your sternum. It can get in your collarbone. There is a woman in Philadelphia who was walking around with a lung lobe exposed. It had eaten through the rib, and then on the other side, it had eaten to the outside world, and her lower lobe was exposed. She was alive. She was still shooting drugs. So yes, you can get them in your core. It's just, it tends to show up more so in your limbs and on the distal aspect or the far end of your limb, because that's where the smaller capillaries are. Remember, it's a vasoconstrictor, so it's constricting everything. But as you get to the end, it gets smaller and smaller. From May of 2024, we have this, which is from jhandsurge.org. And it was an article, a journal entry, necrotic upper extremity infections in people who inject drugs, which was the x-ray I showed you of the gentleman with the broken arm. And it's not a free article. You have to be a member, but you get this little abstract, which is nice. And it says, the purpose, our institution has noted an increase in severe upper extremity infections within the last 2 years. Of course, a lower extremity is much easier to deal with, amputation-wise. The higher you go on a person's limb, the more, as Kim would say, life-changing it is. These patients have required transhumeral amputation. So we know our upper arm bone is the humerus. They're cutting your upper arm off, essentially. This case series demonstrates some of the catastrophic outcomes of these infections in people who inject drugs, which has been postulated or presumed to be related to the addition of xylazine to injectable drugs in our community. Now, as we've learned in the other TED Talks, it doesn't matter if you inject them, if you smoke them, if you eat them or drink them. It doesn't matter how you are ingesting xylazine. It is also being put in cocaine, in methamphetamine. It's being put in everything. They have found it being put in marijuana. It doesn't matter the pathway into your body. You will get sores. You will get them no matter what. So there's a big myth that wherever you inject, that's where the sore comes out. If you are skin popping, a technique where somebody takes their needle, puts it barely under the skin like you would a dog, giving them vaccinations, well, no, that doesn't work. You barely put it under the skin and you give a sub-Q injection and it slowly leaks into the body. It's not a popular way of injecting drugs. Generally, it's for someone in a big hurry who has a big problem with veins. They've blown them all. They can't get in. Then they'll skin pop. Also, you'll see sometimes new users do skin popping because it's a more subtle uptake, because it has to get through all the tissue, all the fat to get to the capillary, to get to a vein. If you're skin popping, yeah, you're injecting, just think of Tranq as Drano. You're injecting Drano under your skin. The problem is the sores pop up wherever they want. As they're finding out, they can pop up everywhere. You can't cut off somebody's rib cage. You can't cut off a hip bone. I mean, you can, but what are the ramifications of that? When it gets into your chest, your spine, you're screwed. I will try to find the lung lady, and I believe she died shortly after being admitted, and not from like withdrawal, not from cardiac, from her infection. She was septic. Of course she was. She had a lung exposed. So why are we having this TED Talk? Well, thanks to Nookie, not the fake Nookie. We have some information from Kim. Now, I know what Kim said. We will get to it. I still question it. I know she has claimed she's going to lose an arm. I don't see how that is specifically life-changing when her arm was already useless. I mean, for lack of better terms. I question her sincerity in wanting to quit. I am not trying to be mean. I have no feeling towards Kim. But of course, as a patient, I don't want any patient to be harmed, regardless of why they are in the hospital or what they have done. A patient is a patient. We take oaths to protect and heal patients. Do you think I liked every patient I had on the fire department? Do you know that one of my frequent flyers was a person who was a registered arsonist who tried to burn my neighborhood? Yeah. And I still was friendly, and I still treated them. I still said hello on the street. They lived 2 doors down from me. Do I like what they did? No. Did I call them in for it occasionally when I'd see something? Yes. But when you're in an occupation that you have to treat patients medically, you have to put that aside. All that anger has to be pushed away because they're a patient. I feel no ill will towards Kim. I don't like what she's done. I know what she says, and I also have lived through her speaking oppositely. So I don't want anyone to bully her. We don't want anyone to say horrible things about her looks, her teeth, her arm, whatever. There's no reason. I'm also going to call out misinformation and lies. So, that said, let's get into it.
Someone help me how many days? I came in here on the 22nd. So I lost count of time. 15 days I have clean. Oh, Harmony guessed 15. She was close.
She actually had 12 at this point, going on 13, but who's counting?
You could do it. I know. Well, I mean, I have some life-changing experiences going on right now. And when I say life-changing experiences, I mean life-changing. I have to make life-changing choices. So I have no choice but to get clean now.
If you watched it, you heard it a lot. Life-changing. Okay, life-changing.
Okay, so Dead Inside is getting buried and Gossip Thoughts is being resurrected. Does that make sense to you guys? Dead Inside is literally almost gone.
The qualifier being almost gone. After 12, 13 days, it should be gone. Gone.
Time we go up on likes and shares, I will tell you more information about why I'm in the hospital. How about that?
So that's the basis of this. Likes and shares. First off, you're sitting in a hospital bed. Secondly, you have a roommate. And thirdly, your nurse comes in, discusses your medication, is talking to your roommate. Do you understand HIPAA violations? You may not care about your own information being broadcast to the world. I don't think your roommate agreed to this. Not only that, please do not treat hospital staff as she does. Please. She is the rudest, most entitled patient.
They said, are you septic? Yes, is a question.
Where is your pain and how bad is it from 0 to 10?
My pain's a 10.
Where is it?
It's on my leg and my arm.
And then can I listen to your heart and lungs?
Of course.
So I have your IV dilaudid, okay?
Okay.
Did you hear how quickly she said she's in pain and it's a 10? Did you also catch it is in her arm and her leg, meaning she has sores on both? This is not 10 out of 10 pain, okay? 10 out of 10 pain, you're not eating, you're not chatting on a live stream, you're not even sitting up. After counting to 10 myself, do I believe she has pain? She has some discomfort. She is medicated. It is time for the next shot, but the half-life of Dilaudid is long enough. It is still in her system. She's also got a fentanyl patch on. She's also got gabapentin in her. All three of those combined mean she is not in 10 out of 10 pain. The thing is, her nurse understands that. Let's listen to it again.
Where is your pain and how bad is it from 0 to 10?
My pain's a 10.
Where is it?
It's on my leg and my arm.
And then can I listen to your heart and lungs?
Of course.
So I have your IV dilaudid, okay?
Okay.
She didn't even let that nurse end her sentence before she said, yes. Are you in pain? She practically swallowed the words.
Do I need to breathe like a different way or breathe in and breathe out or?
Listen to the heart first.
Oh, okay. As we get more lights, I'll tell you guys the type of blood infections I have.
Deep breath.
I am getting better.
Did you catch that?
Deep breath. Deep breath.
I am getting better.
Please don't do this if you're a patient. The nurse asked her to take a deep breath, and she had to speak to her TikTok audience before taking that deep breath. Did you catch that?
Deep breath.
I am getting better.
Deep breath. Deep breath. Deep breath. One more.
5 minutes. Give her 5 minutes. Is what she wants. Sending prayers. Thank you. Thank you.
Never took her eyes off TikTok. She has 2 phones. Not even paying attention. Here's probably, I mean, this is just awful. She is more concerned with the likes, than what the nurse is finding.
It's not working though, right? I don't see the numbers working. Is it just me?
I just want to check your legs. Okay.
For real? The nurse is checking the leg. If you are interested in your own care, you'd be looking too, or at least paying attention.
Come on, guys. You really, damn, 102 and 95. Okay, well, I'm trying to focus on myself right now, guys, so.
Focusing on herself so much, she's interested in her health care.
I don't know. I just really got to think about it. Why did I ask then? Because I don't know. Just something to do, I guess. I wanted to see people's opinions.
Asking in a poll whether she should let Lisa in a box or not. No, this is for likes and views. Would somebody serious about their sobriety want to speak to somebody who is an addict? Someone who claims later on that they kicked their own boyfriend out because he was quote unquote triggering?
Make this live about Lisa. I'm trying to make this live about me and my experience in life. From here on out, I'm going to be going live every day.
Are you having?
Mind you, the nurse is still trying to do shift change assessment, okay? You have to do a full body account. Everything, heart rate, blood pressure, temperature, IV check. You name it. You have to do everything at shift change. And this one is talking through the whole thing, ignoring the nurse. Please don't do that. Please pay attention to your nurse. Shift change happens twice a day. You can give up your Tic Tac for that.
From here on out, I'm going to be going live every day.
Are you having any stomach pain?
No. Sugar Mama, I'm doing good.
She is so patronizing to this poor nurse. So this is the first visit we had from Kim, and this is what she said.
What made you go to the hospital? Because I was on my deathbed. Quite literally. It's either I was going to die or go to the hospital. There is no choice. And it's a lot more than just blood infections, too.
Okay, so she was septic from the sores. She has obviously an open sore, a big one. And yet the poor nurse is trying to do an assessment. Just wait.
Still. Okay.
Trying to do a visual assessment of her pupils.
Just look straight ahead.
Okay. I'm glad you guys are keeping me busy. I'm so bored tonight. I wanted to go live earlier, but I need to wait for my hotspot, so... Have I seen my boyfriend? Yes, I have.
Yesterday was the last time you had a BM?
Mm-hmm.
Was it normal or was it diarrhea?
Diarrhea.
You had anything after?
Yes, I think so.
When?
Oh,
sorry. Today was... You had it today.
Yeah, it was today.
Please don't be this patient. I can't stress that enough. Now we're going to get a lesson in, oh, the audience is mean.
I just want to let you guys know, mental health is a huge, huge part of why I'm in the hospital right now. It's not just blood infections, you know? When people are sitting there picking on you in Discord and calling you names and making up lies, it really takes a toll on your energy, and I start to isolate myself. And, you know, the day I met Lisa, I told her specifically that I'm not the type of person that can take insults or criticism too well. Like, I could wanna myself, and just like with the simplest thing, when people started making fun of my arm and my looks, it hurt my feelings, and I started to distance myself, and I put myself in a bad mental state, you know?
And what are you doing on social media? Okay? And you know, Kim, here's my problem with that. You dished out insults. You made fun of everybody. If you don't want it done to you, then why are you doing it to others? And stop deflecting with Lisa. You want to blame everything on her. You're using Lisa for views and likes. Oh, she wants to join. You isolated yourself because you were addicted to drugs. Not because of Lisa, because of you.
I'm not even going to address certain comments because, you know, no, I didn't come to the hospital because I wanted help. No, I didn't. But that doesn't mean that me getting help can't change, or that I can't, like, the life decision that I have to make is so drastic right now that I don't know if I will want to use once I come out of here. I'm going to be here for about a good 6 to 7 weeks, and I've been here since the 2nd already.
So she's already leaving the door open. I might use if I get out because of this life-changing decision. Somebody who's serious about quitting doesn't say that.
So I have two choices, right? I have make the decision that I have to make, or I have to go home, let the blood infection flow through my body and die, and I can easily break one of my limbs. Well, when do I do? It's a hard decision.
That is not a hard decision. Yes, losing a limb is awful. It is awful. If it's your arm that's already injured and not usable, then it's not such a life-changing decision, is it? Because you've been dealing with that for years. That's why I think it's the leg, because what's going to change? You already don't use that arm. What would it matter? It's kind of not there to begin with. And if you want to quit, you've already made the decision. If you want to live, you've already made the decision. I want to live. So why is that so hard?
Senna is to help you go, and it kind of offsets the constipation that is a side effect of all the pain meds, like the Dilaudid.
Yep.
And then I have your metronidazole or Flagyl. It's one of the antibiotics.
Okay.
I have gabapentin, which with the leg and the arm pain.
Yeah. I'm just more focused on the pain. So that's the gabapentin.
Yes, this is the gabapentin. And then I have the IV Dilaudid for you.
Okay. Can we no, we're not selling fake ultrasound pictures. Thank you.
The yellow is the gabapentin, the white is the antibiotic, and the brown.
And do you mind breaking this in half because it's a little bit too big for me? Thank you.
She's talking to her chat while her nurse is trying to explain the medication. I don't care how many times you've heard your meds explained. Always check. Nurses do make mistakes. Machines make mistakes. Okay? So always, when the nurse is going over what pill is what, look.
No, my arm's not amputated. That's what I've been doing.
Sorry, I have to lift this.
It's okay. They actually push it down right here. To kind of like, it gives it a little bit of a hard time. I'm not sure how they do it. It like,
Yeah.
you know, if you have to do it on the other side and it's easier, that's completely fine. I can't wait to share my website that I built for you guys.
So if you noticed, her hand and wrist are bandaged, so that's where the sore is. So we're talking a lower arm leaving if it's the arm. Because if you notice, her hand is close to her chin. That means she can bend her elbow. If it was swollen at her AC, the inside of her elbow from shooting there, and the sore appeared there, or higher up on the arm, she wouldn't be able to bend her arm that far. So see what I mean? If it's an arm that's leaving, it's a lower arm. So this is the night before her PICC line was placed, and as you can see, her IV is right here. That's what the nurse is checking. If you don't know, IVs can only stay in for so much time, so many hours, and then they have to be moved.
You know, I don't think people realize that bullying over the internet can really take a toll on on people's mental health, you know? And, you know, the last year or so, I went into another deep ass depression to where I isolated myself and I stopped talking to people. I stopped talking in the Discord. I stopped even interacting. And when I did interact, I would get bullied back. It took a toll, all that bullying and all the meanness. And then I just decided to, you know, isolate myself, not talk to anybody. And I was homeless for a little bit. I did have a couple people help me when I was homeless. Then I ended up having blood infections, and my drugs that I was shooting was laced with xylazine. And if you know what xylazine is, which I don't know how much I can say, it's a horse tranquilizer which ruins your skin. I'm here now with 3 blood infections, and the names I don't know off the bat, but also I have a life-changing decision that I'm not really ready to get out yet or talk about yet, and I have to make it. So if I basically don't make the decision, I could die. If I do make the decision, I can decide to live.
Once again, leaving the door open. Somebody who wants to get clean, somebody who wants to live another day, it's not a hard decision. And I don't mean to sound cold-hearted. I understand losing a limb is not like changing a phone number. I understand it is a serious decision. I am not belittling her. I am simply saying, if you have chosen to give up drugs for the rest of your life, if you want to live, it's not a hard decision.
Hard, you know? How do I put this bed up a little bit? Choosing life is hard when you haven't been wanting to live for the longest time, if that makes sense, you know? I'm just trying to be honest. Yes, they want to amputate. Because I have a bone infection as well, and the bone infection can travel through my body, basically.
So there's osteomyelitis, the infection in the bone, and 3 bugs. So the sore is significant. Whether bone is exposed or not, who knows? Doesn't matter. Xylazine is eating the bone. The bone needs to go. Or the bugs will just hide out in there. You have to remember your bone is porous, has little cavities throughout it. And bugs love to hide in it.
Where is my infection? and what they want to amputate. That's the details I'm not ready to talk about yet. No, I have not lost my arm. I still have my arm. Yes, but you guys would be really proud of me. You'd be really proud of me. So I don't want to tell the story because I don't want to embarrass him or his family, and I don't want this to get out. I kicked him out of my room a couple days ago because he was triggering me. So I told him he had to leave. So I'm trying over here, you know. I have to make some big decisions in my life, and I have to start going. Yeah, I don't know. I have to just make some big decisions. No, I was in the ICU. They actually just moved me down to a different unit, and then I'm going to be getting my surgery if I choose to, and then going to the surgical unit. But I was in the ICU for a while because they of the medicine that I was getting.
Well, that tells me the boyfriend's still using. That's why it's triggering. And that's why she doesn't want to embarrass the family or him. And if she's going to stay with him and he's not going to clean up and go to rehab, well, I don't think I have to say it. Now, for an example of what you should never do as a patient or a human being for that matter.
Like braid my hair. Actually, I got free butlers that literally wait on me 24/7 when I need it. If I called right now and said I wanted my broccoli and cheddar soup heated up, it would be brought to me within a minute. And the best part, I don't even have to pay.
Never refer to hospital staff as your butlers, and don't brag about being on state insurance, okay? Because it might not be there for you very long. Just keeping track of what the government's doing. I wouldn't be bragging.
Yeah, I'm able to walk around.
That's the only reason I think it may just be her arm. But I still don't see how losing an arm that you really don't use is more life-changing than, say, losing a leg. Losing a leg, that's life-changing.
Oh, and I plan on writing a book about my story.
How about get sober first? How about be in recovery for a year and then write a book? Just because you go through something doesn't mean you need to write a book. Too many people are writing these pamphlets. They need to stop. They can't even speak proper English.
No, Jalen, I got through the worst of it.
Not if you're still on fentanyl, Dilaudid, and gabapentin.
Done with it? Are you really done with it?
I mean, I want to be, you know. If I were to say I was done with it, I can't say that I'd be lying.
I know what
Do you know what I'm saying? I feel like I'd be lying.
She hasn't done the hard work, so there's no book on the horizon, I hope. So the nurse comes back in, and I've seen people speculate whether she has endocarditis. No, not at this time. Has she had it? Probably. Does she have heart damage? Most likely. Most IV drug addicts do. Usually damage to their valves. Valves are a place where bugs love to hang out. And the reason I say that is because she's just been bounced out of ICU. She's on a floor and she's got a telly box on. Someone's sitting watching her heart rhythm constantly. But then this happens.
The nurse is busy, so I'm just going to take your daily out, so you don't need that now. Your monitor heart rate telemetry?
What?
Yeah.
Wait, what are you saying?
I said right now you need to rest because...
Yeah, you don't need that now. No more.
I don't need it anymore?
Yeah.
So you want to take it off?
Yeah. Is that okay with you?
Do you want to take it?
Yeah.
Okay, so take it.
Okay, I have to take from your chest.
Oh, okay. That's fine. You can do that.
You did? Okay.
Yeah, you can do whatever you need to do.
I'm just going to put my hands in.
That's okay. That's okay.
Sorry, honey.
No, it's okay.
So as the law stands now, we have to ask if we can put our hands inside your gown to disconnect the telemetry probes from the stickers on your chest. Okay? Otherwise, it could be considered SA. Stupid, I know. But if you have an active heart infection, you're not going to be off telemetry. Okay?
Or am I leaving AMA? Why would I leave AMA? See, I got my PIC line in. It hurts really bad right now.
So she got herself a PIC line. She's had them before. And that's because she has shitty veins that she's ruined. So they don't have to keep drawing her over and over. They've put a line in, and now they can draw out of the line. The problem is when you have a patient that escapes, and it happens, and they use that to access drugs. I kind of chuckled at this. If you've taken the previous TED Talks or you took my puffy hand syndrome class, then you know what this was about.
Hands are so red because of, I don't know why actually.
You know why?
Ginger, I'm in the hospital because, I don't know why. Because I just wanted to come and have like a 5-star resort, basically. I mean, who would want to turn down free butlers and people that wait on you 24/7?
Please don't joke about that. I don't think she's joking. And don't go around bragging that you don't pay for shit. Okay? That is not a way to make friends in a hospital. Nobody in the hospital, not housekeeping, not dietary, not maintenance, not even security, are your butlers, bitch.
I know, one day at a time. Well, who would have ever thought that I would have gotten clean?
Ma'am, you are far from clean. How do we know she has a second phone? Well, watch.
People think that I would have gotten clean, yeah, I know. Because I always wanted to be an addict. I said I loved whatever I love. That's true, you know? So, hold on one second.
Checking that phone. Hey, and don't forget, on her website, she accepts e-gift cards. Yeah. Wonder if Dan gets those. Another live.
So how's everyone doing?
And we're on the phone.
I mean, I'm just thinking, like, why do you think, it's just really been bothering me lately, like, why do you think that people feel the need to type that type of shit, like when they're being bullied, you know? Like, that's what I think. I think it's them as well. Sitting in their basement, living off their mom, just like me. I was sitting in a basement living off my boyfriend's dad. But they actually don't want to admit it. They want to make fun of people, you know? Yeah, I'm living in a fucking basement. I mean, I want them to go live and see how it feels. Hi.
Hello.
Hey.
How you feel?
I'm feeling fine. I'm in pain, a lot of pain.
I know. It's time for the login now.
Okay, thank
We'll
you.
do that. Yeah. Did you order food? Did you get your dinner yet?
I didn't get my dinner yet.
But you called, right?
I called.
Okay, it should come. It will come. Okay. Jade is taking over. My shift is over. We want to show her the fentanyl patch and the new PIC line that you got.
Okay.
Just to, for her to be aware of what's going on.
It's 100. Okay. All right, so that's 100, and then
Double lumen PIC line.
turn your arm out for me. Sorry, that one. Okay, perfect. Looks good. Alrighty. I'll be with you until tomorrow morning, okay? Pain 1 through 10 right now.
A 10.
A 10, okay. As soon as I'm done with handoff.
Without a doubt, a 10.
Okay.
Above a 10, if that makes sense.
As soon as I'm done with my handoff with my other patients, I'm going to come and give you medication, okay?
Okay, thank you.
All right, you're welcome.
Did you catch that? She's got 100 milligram fentanyl. 100. She has a fentanyl patch that stays on 72 hours. It is delivering past that 17 hours. I know for a fact, I know from experience. She's getting 8 milligrams of Dilaudid on top of that, plus GABA. I'm going to tell you right now, and I don't mean to be bullying or anything like that. I am not saying anything about her as a human being. As a patient, she is not clean. That is not sobriety. Do you know what bridge is? Bridge is methadone. It is subs. It is Oxy 20, possibly 40 for breakthrough. It is not fentanyl and Dilaudid. It is not. Or Valium. Mind you, listen to the desperation. Pain, I'm in pain. 10 out of pain. More than 10, I'm in more than 10. 10. Hurry back.
All right, I'll be back to see you in a little while, okay?
Okay, as soon as possible.
Yep.
Thank you.
Have a
Because I
great
just
night.
got the PIC line as well, so that's actually hurting as well.
The PIC line is bothering you?
Yeah, really bad.
Yeah, it's quite a deep insertion.
So I heard it was hard to wake me up today, huh?
Yeah, that was the
Was it like
Valium.
probably, but
Valium. Yeah, that was the
was it like
Valium.
probably, but
Valium, yeah.
I mean I need it sometimes. It's just my
And you were
anxiety.
starving.
And I was hungry.
That's why I wanted you to eat. When you came back, I wanted you to eat first and then get more medication.
No, I get it. Yeah, my leg is still in pain, so
I'll come back as soon as I can, okay?
because my pain is over a 10. You guys don't understand what I'm going through. You have no idea what's even going on. Why would I lie about my pain?
Do I need to answer that for you? Do I need to? And this is why I think it's her leg. Because she doesn't say her arm. My arm's not in pain. She says...
No, I get it. Yeah, my leg is still in pain, so...
Her leg. Her leg. That's why I think it's her leg. Sure, she has a big wound on her arm. Her leg would be life-changing. Why would you lie about the pain? Because you want that Dilaudid. That fentanyl patch, you don't get a rush. You don't feel it hitting you. That IV Dilaudid, you do.
Why would I lie about my pain? It's constant state of pounding. Hi, Kaylin. I'm not in pain. Okay, because you think I have 3 blood infections and you just know the whole story? No, there's a lot more going on with me than the 3 blood infections. I'm just not telling you guys because it's none of your fucking business. Yeah, I know. I ruined my life.
None of our business, but you let everybody watch your assessment. We hear every medication you're getting. We hear it identified. Do go on.
You know what? When people comment that stuff like that, it's just like, it just shows how insecure you are in your life.
Ma'am, you are not at a 10. Okay? Some of us have been in 10s. Do you know what 10 is? Fainting while laying down. Passing out from pain. Having a cardiac event from pain. 10 is not eating peanut butter and crackers and demanding meds, chop, from your butlers.
Last two years. You guys don't know what happened to me. There's like 1 person or 2 people in this world that truly know what's going on with me physically. To say I'm not in pain is a lie. I'm in the hospital because I decided to come to the hospital and get help and fix my sickness. Because instead, if I was gonna stay home and die, and I didn't have a choice, they made me go.
Because the very first time you came live, you said they couldn't wake you up. You were so sick, you were out of it. You were septic. Now you made the choice because you wanted to get better? You didn't say that. You said you had to go in.
I'm not abusing the system at all. A 10 means I can't speak? What? Are you a doctor? Okay then, you're not a doctor. I don't really care what you got to say because you don't know what you got going on. Why do you think you're giving me medicine if I'm not in pain? Why do you feel bad for the nurses?
I'm gonna tell them about
Controlled. And if I didn't need it, the doctors wouldn't be giving it to me. Point blank, period. My procedure went okay. They had a hard time waking me up because I was sleeping all day.
They had a hard time waking you up because of all the drugs you're on and Valium. Okay? That's why. The nurse said that. Maybe you have short-term memory loss. You are horrible to your nurses. You're horrible to people. And then you sit and wonder why people don't like you. I'm not saying anyone should bully you, but I can see why they do because you used to bully them. Remember when you helped Lisa on Discord? $5 a question. Oh no, I'm not making any money. Oh wait, what's the truth about that?
Even though they're probably sitting on their fat, ugly, old ass at home. Doing nothing, watching TV all day and eating fucking ramen noodles. Because really, you guys have no respect for people. You guys are rude and you're miserable and you really, I don't know. And what did I ever even do to you guys for you to hate me so much? Like, what did I do to you?
Take a look back. Take a look back, Kim. You were never a nice person. Never. You shouldn't be an inspiration for anyone until you're clean and sober. Until you get out of the hospital. Until you've done the hard work, gone to meetings, been clean for a year. Then you can inspire people.